Enter the room.
Hello,
Hi, doctor.
I'm Dr. Nisa, one of the doctor here in the GP surgery. Are you Brody Jenner?
Yes, I'm Brody.
All right. Can you please confirm your age for me, please?
I'm 20.
All right. And how do you like me to call you?
Brody is fine.
All right, Brody. I understand that you are here for some concern related to your urine.
Yeah, doctor. It's been like burning when I pee just the last few days.
Okay, I'm sorry to hear about it. Can you tell me a little bit more about it? For how long since you have been experiencing this?
It's been like 3 days now.
3 days. All right. So has it been increasing recently?
Yeah, I'd say it's increasing. Yeah.
Okay. Do you feel any pain while passing urine?
Yeah, it burns. Yeah.
Okay. Is there anything that make it better or
Um,
anything?
Nothing makes it better, but if I hold it for long, it kind of gets worse.
Okay, I understand. So, do you hold urine sometime?
Yeah, I guess sometimes.
Okay. Is there any reason for it? Are you
I'm
weak?
just not comfortable, going outside, public toilets. So I just go home. I just wait till I get home.
Okay. Are you not comfortable to use the toilet? Is there any reason? Is it related to the hygiene or anything else?
Yeah, it's just dirty. That's all.
All right. Okay. Do you have any fever?
Yeah, it will feel a little warm, but yeah, I haven't checked my temperature per se.
All right. Do you think that you are increasing, you are going to the loo more often?
I'd say yeah, in the night sometimes.
Mhm. Have you noticed any color changes in your urine?
No, not really.
All right. Have you noticed any smells in urine recently?
No, not really.
Okay. Uh, Apart from this, do you have any other symptoms?
No, nothing else. Like anything specific?
Well, any lumps or bumps anywhere in the body?
No, not really.
Any weight loss?
No.
All right. Have you had similar symptoms before?
No, doctor. So first.
All right. Do you have any medical condition?
I have PCOS.
Mhm.
But I'm not really taking anything for that.
All right. And are you taking any medication?
No.
All right. And anyone in the family has any significant medical history that I should know?
Um, no, nothing specific.
All right. And can I know what do you do for living?
I'm a student.
All right. So I understand you told me that you hold urine some for sometimes you're not comfortable using the toilet, public toilet. So how often do you have to use the toilet when you are outside?
Mm, um, Pretty often I'd say like at least once or twice a day.
Mhm. And can you tell me how long you hold urine?
Mm, Like till I get home, maybe like 3 or 4 hours max. That's all.
3 or 4 hours. All right. Okay. So thank you for letting me letting me know all the information. Now I'd like to examine you. I will be checking some vitals, your blood pressure, temperature, respiratory rate, oxygen saturation, and also I do a urine dipstick test and will examine your tummy. Is that all right with you?
Yeah, sure.
Okay. Thank you very much, Brody. So I have done examination and there is some changes I found in your urine. So I'm suspecting that you could be having urinary tract infections, the urine infection.
Oh.
And it is a treatable condition. We can treat you within giving you antibiotics for around 7 days,
Oh,
nitrofurantoin. How do you feel about it?
yeah, sure.
All right. And the reason that you developed this urine infection is you are not using the public toilets and you are holding urine for such a long time. So if we hold urine for a long time, it can cause the infection because the urine is something that is toxic. We should pass out as soon as possible. So it is highly advisable not to hold urine.
Okay.
So will you able to use the public toilets?
I'll try. I'll try, doctor. I know. I feel a little uncomfortable sometimes. But yeah, but I don't know. If I have to go to a male toilet, if I'm forced to do that, sometimes I don't like it at all.
Mm. Can you tell me at this moment which facility do you use and do you want to use? Is it a male
I
facility
use
or the female?
so
Sorry.
I mean, as you see, I look like a male, and I'm kind of forced to go to the male toilets, but they are very dirty all the time. I don't really know what to do.
I understand. Now I understand where you are coming from. So I just need to ask few questions. Are you transitioning at the moment?
Yeah, doctor.
Okay. Can you tell me a little bit more about it?
I mean, I identify as a male, but I haven't really done anything for it. But
Mm-hmm.
yeah, I just identify as a male. Yeah.
Okay. We can also help you in that. But currently, I would suggest that if you are comfortable using the male bathroom, so use this. If you are comfortable to the female bathroom, you can use that as well. And there is some toilets available of which universal. That means male or female both can use. So maybe you can find some toilet like this and maybe use it. How do you feel about it?
Yeah, sure, doctor. I'll look into that. Is there
Thank.
any, I mean, I feel a little lonely, I don't really know, have anyone to talk to about these things.
Mhm. All right.
Anything that I can do for that?
Yes, there is a lot of help available. And if you want, we can make another appointment for you to discuss about it, and we will guide you what to do and what is the next step.
Right.
Oh,
Time is over. Hey, that was really good, Dr. Nisa. So,
I was really hesitant on the part how to ask. I know he's transitioning by the name, but I was afraid to ask. I felt like I will be judgmental.
yeah, exactly. These cases are very difficult to handle in that aspect, but you shouldn't think about it that way. Think about it like how you would actually normally. You did really well. That's perfect. But one thing that could have helped you in your data gathering early on is to know if the person is biologically female. That's something that you can directly ask. So what you can, instead of directly asking that, what you can do is, can you please confirm your birth name? And since you already
Oh,
have that information in the question, right? If you see the question says birth name of Claire Jenner, right?
mm-hmm.
You can bring that up. That way, you have some confirmation that, okay, this person has a different birth name and now he has a different, identifiable name that he's using. So, so you like already established the fact that, okay, then you're not doubtful anymore, right? So you don't have to outright come and ask, say, okay, are you biologically female? Are you male? All that thing. And usually they'll tell you. So right now, what is this person's main problem is just the burning sensation, right? And
Yes.
1 second, I'll just pull up the feedback. I think the examiner will explain you better.
Hey, hi, Dr. Lisa.
Hello.
That was a great performance, I have to say. I mean, you did touch upon a lot of important points, and you didn't get sidetracked. I know it was difficult for you to bring that fact up to understand is that causing it, which is exactly what you should do in these kind of cases. You know, this is like what they're trying to see is your cultural competence. So unless it's relevant, unless that is their problem, you shouldn't bring it up, right? Even though you identify that this is a patient who is, undergoing transition, but there's
Mm-hmm.
always that thing of, understanding what exactly their problem is. So all right. So here's the mark sheet. So a couple of things. So when even in the identifiers, one of the identifiers that is given to you is the birth name. So that's also an identifier. So do ask that, right? I mean, there's no problem in asking that fact of what's your birth name? How do you identify yourself? How would you like me to call you? But that was all right. But just about the birth name, since it's already given in the question, always use whatever is given in the question, to make your case stronger. And second of all, you told him to elaborate the presenting complaint. That was absolutely correct. You went in all the right directions. But what you had in mind at that time would have been either is it a UTI or is it an STD, right? So
Mm-hmm.
you have to ask questions to rule STD out as well. So sexual history would have been important, because that's the other main differential that it could be, right?
Yes.
So
Yes.
that's one point in your data gathering. Otherwise, it was all good. Otherwise, other questions that you could have asked would be about the P questions, because biologically, this person is a female. So you will have to
Mm-hmm.
treat the UTI and give the person advice, as you would give a biological female, because that's what would work for this particular person. But identify them and give them the respect of, their transitioning, right? So the P questions also would have been important, and but not that necessary. So we're just looking for every differential that can be causing burning sensation. So when you think around those lines, what all questions would be important you need to ask, because you'll have to rule out the differentials. And the main differentials over here would be STI and UTI, right? But since there was the cause of him holding the urine, that came up. So I think you were more lenient towards the UTI diagnosis. But yeah, that also works because that's a major risk factor, right? So after that, you went on to explain that this is actually uncomplicated UTI, right? So that's why you'll be giving them a short course of antibiotics. So when you're telling the diagnosis, you can say the whole thing as well, or you can say it as a urinary tract infection. That also works, but I've given you marks for that. So probably most likely due to you holding your urine. That was exactly how you should have explained it, because you need to show that correlation. That is very well done. Good job. Right, because this is happening. That's why you're having this problem. So then they'll understand that, okay, this is something that I shouldn't do. So now if you understand a little bit, what is the key issue over here? That he's finding it uncomfortable to go to a male toilet, right? Because obviously he has not had his operation. That's also something that he said. And he's only started to identify himself, right? So he's, identifying himself as male and dressing that way. So one thing that you could have referred him, and that is, I think, the more important, one of the more important managements here, is to refer him to a gender identity clinic, because that would help him to make peace with the fact of where to relieve himself like that, because this is a major problem. I mean, not having to relieve yourself for a very long periods of time can actually cause problems, and we're trying to minimize those kind of problems. Giving him antibiotics is fine, but also how to prevent it to happen in the future, right? maybe you're not the right person who would know all the information, like how you would refer somebody to a specialist. This is the right place where you can actually refer them to a gender identity clinic who will actually give you support and help you make peace with certain aspects that you find uncomfortable, right? So saying that, you'll say, I'll set up an appointment, right? And then for more support, you can tell them about the LGBTQ Foundation. That also helps with, uncomfortable situations that people there can give you advice, and, you can learn from their experiences, right? You're showing him that there is a group behind you that actually supports you. I mean, that was also one of his issues, right? I don't know whom to talk about this. I mean, I'm having to deal with this myself, and I feel the best way to deal with it is just holding it in. Right? If somebody was there to give you a little more confidence, maybe, that wouldn't be an issue for him as much. And yeah, and other advices you can tell him, like, make sure you drink plenty of fluids, especially for the UTI to clear. And once you start, so in UK, they don't usually give antibiotics unless required. Right. So one of the guidelines that we pulled up from the NHS guidelines is, since it's an uncomplicated UTI, you tell them to wait for 2 days, prescribe them antibiotics, but you tell them to wait for 2 days, and if the symptoms don't reduce, then to start the antibiotics. So they want it to be self-limiting. I mean, until if you follow the usual hygiene, it might clear up. Otherwise, if it doesn't, then you can start the course of antibiotics. So then you'll have to give those general advices as well. Like, don't wear any synthetic tight underwear. Make sure you clean the area well from front to back. Some general advices. You can offer them pamphlets and leaflets that would show them those general advices. Give them the antibiotics. But what was the presenting complaint though?
Burning sensation during micturition.
Exactly. So then you never give any medications for the pain. So
Oh,
always treat the presenting complaint, because that's what they came to you for. So antibiotics was correctly identified. You need to give, yeah, all right. But you always have to treat the presenting complaint. So make sure I'll give you this for pain, like paracetamol for pain. And if he has fever, that will also help with that, right? And then, so that's for the treatment. And then now coming to other things that you should try to transition into as soon as you hear the 2-minute bell is to somehow incorporate safety netting, follow up. Follow up you did. In fact, that was very good. Follow up you did, but also safety netting and leaflets, pamphlets. I mean, even when you're talking about the antibiotic, even when you're talking UTI, you can just tell him that, how about I also give you some leaflets and pamphlets, like way in the beginning itself, just to get that tick. that
yeah,
so that
that's
you
very good idea.
Yeah, absolutely. Because you're informing him and you're telling him that I want you to also keep yourself informed, right? So that will be a good, easy way to deliver that. But amazing, you did not make the person feel uncomfortable. He was not offended. That is a very good consultation, I must say.
Thank you.
So
This is my biggest weakness because I feel like I'm going to judge the LGBTQ person, and I feel uneasy. I try to be very careful asking questions.
absolutely. I understand. I think that is one thing that we also find troublesome. Like, we don't know which part would be relevant. So unless you identify that something about the transition could be a risk factor, then only go into it, and go into it in a very comfortable, very comforting manner, not in a way that they feel conscious about it, right? Always signpost when you're going into it, right? Ask them a little bit more about it. I would like to ask you, since this might help me in treating you better, understanding your situation a little better. So basically, it's a person who identifies as a male, but then ultimately, biologically, this person is a female. So you will have to go through that female questionnaire, because those might be some of the risk factors that you have to, because you'll be actually giving them treatment as you would be giving a woman with uncomplicated UTI. So all those
So
information
can
that are
I ask,
important, you have to think about.
sorry to interrupt. Can I ask about the period here or?
Yeah, if you think it's going to be a risk factor, she said she has, I mean, he said he has PCOS, right? So, it
Yes.
could be a good question to bring up. Yeah. I
Mhm.
mean, you can ask if it's controlled. Yeah, absolutely.
Okay.
But you'll have to always think along the lines is this helping me make a diagnosis? Right? So even when you're asking a question, if you think it could help you make a diagnosis, then ask, right? Otherwise, as soon as I know the feeling of as soon as you see that it's an LGBTQ case, you want to ask the questionnaire, the LGBTQ questionnaire, but if it's not relevant, don't bring it up. Right? I mean, imagine every time they go to a doctor, all they have to first of all answer is everything about that transition. That'll become a little, irritating for them also, right? So they may act out. So yeah, you want to make sure the person you're talking to is comfortable and his problems are dealt with. So main thing about that also is that you should have asked the ICE questionnaire. I mean, you should have asked about ideas. Why do you think this is happening? That was one way to bring it up. Like, why do you think this is something that you're happening? Is there anything you think is causing it? Right? Is there any particular concerns? What are your expectations? So it could be that he would have said that, I hope that I don't have this feeling of burning when I am urinating. So I find that really, problematic. So then you would have actually given him painkillers.
Yes.
Yeah. So yeah, try always to ask the ICE
Uh,
questions because that's the main issue that you have to tackle. But good job. That was a great run.
Thank you.
So anybody, do you guys have any questions, any comments, anything you guys want to share? That was a great performance by Dr. Nisa. If nobody has any comments, then we'll drop off and we'll see you guys back in half an hour. 9 o'clock, we're having another one. So hope to see you all there. I'm sorry, 4:30.
Thank you very much. Thank you a lot.
Thank you very much and good luck for your exam.
Thank you. Have a good day. Bye-bye.
Okay, guys, bye.